Your body shape and contours define your appearance. The body you were born with may or may not have the curves or musculature you desire. In some cases, damage from an accident or certain health conditions may make it difficult to improve upon certain areas with exercise alone. Body contouring implants are designed to change the appearance of the chest, biceps, calves, or buttocks. These areas can be augmented by implants alone or in conjunction with body fat transfers, depending on the changes you desire and your available body fat. AART body contouring implants can effectively help you achieve the smooth, shapely contours that you desire, enhancing your self-confidence and appearance. Body implants are made of FDA-approved, soft, solid silicone. The implants are frequently chosen to enhance body areas for any of the following reasons. Areas are asymmetrical. An area is not well developed. An area has reduced bone structure or muscle due to a health condition. An area has lost volume as part of the normal aging process. Body contouring implants improve or accentuate the appearance of body contours, muscular strength, or volume. Use your pointer to roll over the model's chest, buttocks, or calves to see a variety of styles and sizes of pectoral, gluteal, and calf implants available from AART body contouring implants that can help you achieve the look you desire. The assortment of AART body implants that are available today allow for customization. The combination of the shape, size, and position of the implant is used to fine-tune the degree of fullness or distance of projection in a particular area. Your physician can use these combinations to smooth or emphasize curvature or definition in your calves, pectoral region, or buttocks, and can even create the appearance of longer legs. Your physician will help you choose the style of implant and surgical technique that will best achieve the look you are after. It is important to keep in mind that implant size is limited by your anatomy. Depending on the tightness of muscle or tissue that will surround the implant, the thickness of the style you desire may need to be adjusted during the surgical procedure. Your physician will use the best option to achieve optimal results and facilitate proper healing. This animation demonstrates the gluteal implant procedure using an AART Style 2, Size 3 implant. Several surgical techniques may be used for gluteal implants depending on the desired position and appearance. The two techniques that generally produce the best results are the intramuscular and subfascial buttock augmentation procedures. Intramuscular augmentation involves creating a pocket within the large gluteus maximus muscle. In contrast, the subfascial augmentation procedure creates a pocket under the fascia, which is a membrane of tissue that covers the top of the muscle. Using these techniques, the implant is protected by tissue under the skin or tissue and muscle fiber, producing a comfortable, natural-looking, and visually pleasing result. The procedure begins with an incision through the skin along a pre-marked line near your tailbone at the top of the intragluteal crease, which is the line that extends between the buttocks. Using an electrocautery device or a scalpel, the physician carefully cuts horizontally beneath the skin layers to access the fascia above the gluteus maximus muscle on each side of the buttocks. As you learned earlier, there are different implant placement options available. This animation depicts intramuscular implant placement. Retractors hold back the skin while the physician carefully cuts through the fascia and proceeds to separate fibers of the gluteus maximus. A pocket is formed within the muscle that is approximately 1/2 inch larger than the implant dimensions. Your physician may use an endoscope or fiber optic retractor to check for complete dissection. A drain, which allows fluid to exit your body as you heal, is put in place and the pocket is cleansed. Your physician will insert and carefully position a sterile implant, ensuring a tension-free fit inside the muscle. Once both implants are in place, your physician will verify that they look natural and symmetric. The openings to the pockets for each implant are sutured with dissolvable stitches. The openings used to access the sides of the buttocks under the skin are then sutured to the midline, and the incision in the intragluteal crease is closed. This incision may be sutured and/or sealed with adhesive. Finally, a bandage is taped after surgery to provide compression and support. Your physician may place you in a compression garment that you will wear for a couple of days to several weeks. This garment helps reduce swelling by preventing fluid buildup while improving blood circulation and supporting the new contours of your buttocks as you heal. You will need to sleep on your stomach and should avoid sitting as much as possible for approximately 2 to 4 weeks. You can expect some stiffness and swelling in the buttocks and nearby regions, which results from the incision and tissues being stretched during the operation. You may also experience some minor pain, which can be controlled with oral medications. Surgical drains will likely be removed in a few days to a week, while any non-dissolvable external sutures will stay in place for 1 to 2 weeks. While you may feel well enough to return to work and normal activities in 2 to 4 weeks following the procedure, you will need to avoid strenuous leg exercise for about a month and a half. You will notice results from body implant procedures immediately. Swelling after the procedure may cause the skin to appear shiny at first, but it will subside within a couple of weeks, and the skin will regain its normal appearance. As the swelling subsides, the area that received the implant will soften and will look even more natural. Your muscle movement should not be affected. The implants are placed so that they are unlikely to shift, and the muscles surrounding the implants will stretch to comfortably accommodate them over the following months. For each type of implant procedure, scars are hidden in creases or in areas where they are difficult to detect, and they will fade considerably over time, making them almost imperceptible. With AART body contouring implants, you can achieve the shape, definition, and contours that you have always wanted.